It's time for Access the Experts from the University of Nebraska at Omaha with your host, Brandon AKSAMIT.
Hello and welcome to another edition of Access the Experts on News Channel Nebraska, where every Tuesday and Thursday, University of Nebraska at Omaha faculty members answer today's questions facing our state. Now today we have the pleasure of hearing from Dr. Susan Reay, who is an assistant professor at UNO's Grace Abbott School of Social Work. It's Suicide Awareness Week and September is Suicide Awareness Month, so we are putting an emphasis on mental health. So Dr. Reay, today's question is, how do you know when to ask for help?
Hi, Brandon. Thanks for having me today. The question today is, when do you know that you need to go to therapy? So it's a really great question that I think a lot of people have. And it's very unique and different for each person, but I'll give you some of the most common reasons that people have decided to go to therapy or why they may think they need to go to therapy. Sometimes it's because of something that someone has said to them, like, maybe you should go to therapy, or maybe have you thought about it this way, or have you ever seen a counselor? And it may have been a time when they told you that a long time ago, but you've been thinking about it. It's kind of been rolling around in your head for a while. So there's something there, but you just haven't been able to pull the trigger yet to actually make it happen. Sometimes, you know in yourself, I think it would be good for me to go to therapy. And sometimes it's something that somebody else brings up. Some of the common reasons that people go to therapy is oftentimes it's substance abuse related, when they're drinking too much or using drugs and it's impacting their daily life. It could be problems with sleeping, like you're not sleeping like you used to. Sometimes it's stomach problems or headaches or challenges with focus. Sometimes it's because of a sudden change in your life, like you've gone back to school or you have a new job or some death in the family or something has happened that has kind of brought up some issues for you that you really just want somebody to talk to that is trained and be able to work through some of those problems. I assure you that therapy helps to make people's lives better. So I know it can be scary to go, but I assure you that therapists are not scary people, and we're there to help you, and we're nice, and we want to help you go on this path of guided discovery to figure out who you are. We don't tell you what to do, we're helping you to figure it out. Certainly we want people to go to therapy for anything that would be really significant, like an acute or thoughts and feelings of suicide, or major depression, like you can't get off the couch. But it really is a full continuum of reasons that people go to therapy. I would just encourage you all that if you've been thinking about it, if you've got something that you want to help working through, that you find somebody to talk to about that, a licensed and trained professional. There are resources all around the community as well as on the UNO website. You can find resources by going to unomaha.edu and putting in counseling, and that'll take you right to the CAPS Center. But also there are resources in every part of the state, and therapy can be provided in many different ways and in many different locations. So I assure you that there's hope that things can be better, and we encourage you to reach out and give it a try.
Thank you, Dr. Reay, for sharing your expertise on the very important topic. Now, for our viewers at home, we want you to interact with UNO's experts, so if you have a question that you want answered, submit it at newschannelnebraska.com.
If you have questions, submit them on our website. Then join us every Tuesday and Thursdays at 6:46 a.m. and p.m. while we answer your questions.